See, this is anterior cranial fossa. This area is frontal air sinus. After cutting, frontal air sinus is visible, and this area is frontal crest. Okay, followed by frontal crest, we are having cipriform plate of ethmoid bone. In the middle, we have elevation. This is crista caeli. Okay, crista caeli, and here one foramen used to present. That foramen will not seen in all the skull. That is foramen cecum, and in here we will get anterior and posterior ethmoidal foramen, that also not visible properly. Then this portion is known as orbital plate of frontal bone. This portion is known as jugulum sphenoidale, and this whole thing is known as lesser wing of sphenoid. Lesser wing of sphenoid bone. This elevation is known as anterior glenoidal process. Anterior glenoidal process. Then we have the middle cranial fossa. Middle cranial fossa, we can see this is greater wing of sphenoid bone, and this is petrous part of temporal bone. Both are divided by a small sulcus. We can see that sulcus very much nicely in this skull. Then in the central area, we will have a small elevation and depression. This central area is known as Sella tursica. In the center of the Sella tursica, there will be a big depth gap. That gap is known as hypophyseal fossa. Anterior part of the Sella tursica is known as tuberculum sellae. This tuberculum sellae, and the most anterior most part of the tuberculum sellae, we will have the sulcus chiasmata. This area is known as sulcus chiasmata. This area is known as sulcus chiasmata. This is tuberculum sellae, and the margin, the posterior margin of the tuberculum sellae will have small projection, that is middle glenoidal process. Then we having dorsum sella. Dorsum sellae, the elevation is known as posterior glenoidal process. Then we come down means we will get foramen lacerum. Foramen lacerum is a irregular foramen. Followed by that, we will get three foramens somewhat in a straight line. One is foramen rodentum. It is a blind foramen. It will be open into pterygopalatine fossa, so it will be not visible. Then foramen oval, then foramen spinosum. Then in this side, this is optic canal medial to the anterior glenoidal process, and posterior to the anterior glenoidal process we are having supraorbital fissure. Okay.